So then the next question is, once we make the diagnosis of MDS, then the question comes is the prognostication, how we risk stratify patients. So we had various scoring systems. Historically, something called revised international prognostic scoring system, which we used to include the blood count abnormalities. Along with that, the some of the genomic testing, mostly the chromosomal changes, but that has evolved into incorporation of molecular abnormalities as well, which actually accurately capture the genomic heterogeneity as well as stratify patients, because it has therapeutic implications down the line. So as you see, some patients with international IPSSM, which captures the molecular mutations along with the blood count abnormalities and the chromosomal changes, can upstage a patient who is historically thought to have low risk into a high risk category, and vice versa as well. Sometimes patients were captured as high risk, but with their molecular mutations, they can be downstaged into low risk as well. So this has as I mentioned, this has therapeutic implications. As you can see in the slide here, so it can guide you in terms of deciding whether the patient needs to be referred for a bone marrow transplant or not, because only with high risk MDS we recommend bone marrow transplant if they are eligible in the sense that, if they're less than 80. We have at Vanderbilt, we have transplanted patients who are in their late 70s as well, if they have a good performance status and no comorbidities. And we just do not take one particular age cutoff in determining their transplant candidacy. We take both the comorbidities, the performance status as well in taking into consideration. So every high risk MDS patients, if they are eligible, needs to be at least evaluated by a transplant team to determine their transplant candidacy, because that is the only curative therapy today available for patients with high risk myelodysplastic syndrome. And then low risk MDS, we'll talk about what are the treatment options available for these patients.